Hello and welcome to Newsmax TV. I'm John Bachman. Joining me right now is Tevi Troy. He currently works as a senior fellow at the Hudson Institute and is the former deputy secretary of the Department of Health and Human Services, serving under President George W. Bush. Mr. Troy, thanks for being with us today.
Thanks for having me, John.
It's our pleasure. Let's talk about Obamacare. We recently learned that the White House was delaying a key provision of the Affordable Care Act, the so-called employer mandate. And some people, including yourself, say this is just the tip of the iceberg here. Meanwhile, the president and other members of his cabinet and Congress say that the legislation is still mostly on course. Are these people lying to us? And if so, why?
Well, I don't think they're lying to us per se, but it is interesting the timing of the announcement was right around 5 o'clock on July 4th weekend, and it was done by a Deputy Assistant Secretary of Treasury that neither you nor I nor anybody else in America had ever heard of before it happened. So I think they're trying to show a happy face to the world and say that everything's going along smoothly, but the fact that they're delaying this central provision to their law means that all is not well in paradise. And as I know from working in administration, when you start delaying things, those things don't end up getting done.
Yeah, we've heard all kinds of promises, including the fact that this is still on track and we could expect things to be in place for the exchanges on October 1st. But even after those kinds of promises, what are some of the repercussions that we can expect if the healthcare exchanges are not ready by October 1st?
Well, I think there will be some version of healthcare exchanges on October 1st, but if there are no health exchanges, and if this individual mandate goes into effect, you could see some real chaos. I mean, people will be told they have to have health insurance, but they may not have the ability to do so. I think what's more likely is you're going to see costs go way up. The employers are still concerned, even with the 1-year delay, about the cost of this, so they're more likely to dump employees. You're not going to have the people have verification, so there's going to be a lot more people asking for subsidies. So this law that was originally supposed to be budget neutral, which I never believed it was, and then went up to a cost of $1.8 trillion, and now the minority staff on the budget committee is saying it's about $2.7 trillion. I think the costs are just going to get higher and higher.
And so you think even without this employer mandate in place for 2013 or 2014, you still anticipate employers laying off some of their employees?
I'm not saying they're going to lay off per se. I think you're going to see three activities by employers. One is try and keep the number of employees who are full-time to under 50, so small businesses can do that. Obviously, a huge corporation can't do that. Then you're going to see people try and keeping hours under 30 so that they're not considered full-time employees. And then the third is when I said dump, I mean drop people from health insurance coverage, pay the penalty, which they don't have to do for the first year thanks to this delay, and then just say we're going to pay the penalty for not having people covered, but we know you could be covered in these exchanges, which are really not going to be so great. So I think they're going to use different strategies to minimize the costs because, bottom line, employers are profit-maximizing institutions.
Delay or not, so you're saying that the employer mandate will still be felt by employees. Now, let's say, for argument's sake, that things do get worked out here and the rest of the legislation is implemented as planned. What do you anticipate being the biggest issue or problem come January 1st, 2014?
Well, I think right on January 1st there's going to be confusion. People aren't going to understand things. The Obama administration isn't necessarily that skilled at giving forms that are easy to do. So the initial version of the form is something like 21 pages of really complicated stuff. So I think that's the initial short-term problem. They might work that out, but I think the cost problem is a much more pernicious and problematic and long-term issue, and I think that one's not going to go away so easily.
And that's the one that everybody is concerned about, with healthcare costs increasing so much over the last 10 years or so. This kind of dovetails into my first question, but I want to get your take on this. Is the White House not being completely honest with the American people about how ready they are or how unready they are for this? Or are these failures a sign of incompetence, or is this just based on the fact that this law is too big, too complicated, and therefore unworkable?
Yeah, I'm not in a position to really say that they're lying or being less than truthful. I think this law is just really complicated, really hard to do, really problematic. I think the incentives in the law are skewed, and so it's just hard to put this thing into place. It takes a long time to get this together. When you have a law where all the pieces don't quite fit, you're going to have these kinds of delays. In fact, I think in some ways the administration was quite honest in doing the employer mandate delay. It tells us just how badly the implementation is going if they're willing to admit to it, because it's not something they want to do easily. I mean, they knew that there would be bad stories saying that the mandate delay is indicative of a problem with implementation. So they knew they were going to take that hit. They didn't want to do it, but they did it because they really weren't ready.
Yeah, and the reason I asked that question is because we hear some Republicans wondering aloud if this was done for political reasons, to put it off until after the 2014 midterms, perhaps another way for President Obama to kind of funnel people into perhaps a single-payer system. Those are just some of the theories that we have out there. But we've also seen House Republicans vote to slash the IRS budget by 24%, which is one way of stopping Obamacare, since the IRS is supposed to play such a huge role in the implementation and enforcement of this law. What do you think about that vote coming from House Republicans?
Yeah, I think that the impetus behind that is the IRS scandal, where the IRS goes after people based on their political ideology, as we saw with them going after the Tea Party groups. And so people on the right and people on the left as well just don't trust the IRS, and there's good reason for it, and there's history there. I was doing some reading recently, and I saw back in 1952, when Richard Nixon was running for vice president, someone at the Bureau of Internal Revenue leaked information about Nixon's tax returns that were supposed to reflect badly upon him. So shenanigans at the IRS have been going on for a long time. Even if you cut the IRS budget, though, I don't think that means Obamacare is going to go away. You'll have fewer agents to enforce it, but you're still going to have it on the books, and people will be obligated to get insurance or pay the penalty.
Yeah, and it could make things even more messy than they already are. There has also been, continued questions hovering over HHS Secretary Kathleen Sebelius and her request to healthcare industry groups for donations for Enroll America, the body that's supposed to help get Obamacare off the ground. Do you feel like Sebelius broke the law in her actions there?
Yeah, I'm not prepared to say she broke the law, but I think there was inappropriate behavior there. I think you really shouldn't have the chief regulator of the health industry going out there and soliciting these types of donations. I know that in the Bush administration, we were very careful about this kind of thing. We got very strict rulings from the general counsel's office at HHS about what we could and couldn't do. And to the extent that there were outside dollars paying for the implementation of Part D, these were voluntary activities that we did not solicit. In addition, there was some money within the law that was provided by Congress, and that's okay if Congress provides money that goes to an outside group to help the implementation. But here we're talking about money that is not provided by Congress, and she's trying to solicit outside funds to get things done that she wants done. I think that's a no-no.
All right, Tevi Troy, who formerly worked in the Department of Health and Human Services, obviously with a lot of knowledge on this, and we'll wait to see for perhaps the other shoe to drop on Obamacare and perhaps more delays coming from the White House. Time will tell on that. Thanks very much for being with us today. A pleasure talking with you.
Thanks for having me, John.
And thank you for watching Newsmax TV.